Hello everyone. So today in this session we'll be talking about lower genital tract infection. So in lower genital tract infection we are going to study about the four important entities. So the four entities that we are going to talk about today in this session is Trichomonas vaginalis, bacteria vaginosis, candida, and chlamydia. We all have really confusion regarding this, and it's very difficult for us to remember. Moreover, similar to that of microbiology thing, that is why I'll be helping you out with beautiful certain mnemonics, which will really help you to understand. Okay, so first of all, always remember that candida candida is cool. Okay, candida is cool. So remember this cool, you need to remember that whenever we have in during summer, what happens? There is excessive sweat, and because of that sweat, what happens is we tend to there's a foul smelling discharge, isn't it? Now what happens with chlamydia, since what we use during summer, we use the powders in our armpits. Okay, why do we use? For a better smell, right? So what we use is we use this cool menthol, isn't it? This cool type of this powder, cool powder. It comes like with Saruk Khan being in the ad, cool powder. Why are we using this? So that there is no foul smell from our armpits. The same logic you can remember over here. So no foul smell. So candida is the one where it's non-foul smelling. Okay, it is non-foul smelling. It is non-foul smelling. Whereas all other are foul smelling. So was it easy? Easy, no? It's very easy. Okay. Now remember that this candida, see again the mnemonics with candida. From this candida you remembered cool. From this candida you can remember curd. Okay. So curdy discharge or creamy discharge is more with candida, curdy or creamy. Okay, curdy with or creamy. Okay, we're not talking about chlamydia, we're just talking about a candida. Okay, candida. Okay, you know, thinking chlamydia, this chlamydia also is also starting with C, no? So I'll remember, don't jump into chlamydia right now. Okay, so I'll be talking about how to remember that. See, always remember Trichomonas vaginalis is a green color. Okay, bacteroid vaginosis is a gray color. So we don't have a gray color over here. So it's a gray color. Gray, Grey, gray. Okay, since I don't have gray color, I'm not putting any color. Okay, chlamydia, remember, is yellow. Okay, yellow. Now we have two different entities. Okay, two different entities. So if there was hemorrhage, if there is trauma in the cervix, the cervix will look traumatic, like there will be laceration, there is a trauma, right? Now remember that, you know, the traffic light has three color: red, yellow, and green. Okay, so yellow we have already understood in the chlamydia. Yellow is something in between. Red means you can go, green means you can't go. That red green mixture is always in the Trichomonas vaginalis. Why did I say red? Remember, a red fruit, which is strawberry. So strawberry type of cervix is seen in the case of Trichomonas. Okay. Now Trichomonas is a parasite. Bacteria vaginosis it's a bacteria, right? It's a cocobacilli. Candida is a fungi. It's a fungi. Okay. And chlamydia is also a bacteria. Okay. Okay. Now we understood this one, right? Now remember. Foul smelling thing also we understood, right? Now remember. The most important thing is, why did I write in this fashion? There was a reason, right? Trichomonas vaginalis, bacteria vaginosis, candida, and chlamydia. Okay. I wrote in this fashion. Why? So whenever we write Trichomonas vaginalis, bacteria vaginosis, we write BV. This one is TV, right? So this both BV and TV, these both are alkaline. Okay, and this both are acidic. This is just a way to remember. Okay, there's no hard and fast, because more you practice you'll understand, but here as in a way to remember, because in the exam hall everyone will forget everything. That is why we are trying to remember in the best way possible. So this is acidic. Okay, this is alkaline. Remember, candida and chlamydia. See, the word are very small, no? You can remember in this way also. The word are very small. So acidic is 1, 2, 3, 4, 5, 6. Acidic 6-letter word. 6-letter word looks like C also. This 6 looks like C also. So it is a candida and chlamydia. These both are alkaline. 1, 2, 3, 4, 5, 6, 7, 8. Okay, so it's a 8-letter word, right? So it's a long word. Bacterial vaginosis, trichomonas vaginosis. But this is a short word. And C looks like 6 also. So candida and chlamydia is acidic. The only non-foul smelling is candida. You can write this, right? Trichomonas is a parasite, red-green. What did I say with red-green? Strawberry cervix and greenish for the discharge is seen, right? Bacterial vaginosis is a gray discharge. Candida, curdy or creamy, right? Chlamydia, purulent discharge. Okay, this is a purulent discharge. Chlamydia is a purulent discharge. Just remember in that way, okay? Next is, how are you going to treat this condition? So this is a fungal infection. So what are you, this is a parasitic infection. So what are you going to give your metronidazole? Bacterial vaginosis, what are you going to give? You are going to give metronidazole or clindamycin. Candida, what are you going to give? You are going to give azoles. Okay, azoles group of drug. Here, what you are going to give? Azithromycin group of drug. Now see, first we said this as one partner in being alkaline, and this as one partner in being acidic, right? Now we will take this one as one, and we take this both as one. How? See, if the patient has trichomonas vaginalis, the partner also must be treated. Your partner treatment not needed, your partner treatment needed. Partner treatment needed, partner treatment not needed, but in the between there is partner treatment is needed. Not needed in both this. Okay, so in a nutshell, let's revise this, okay? In a nutshell, it's very easy. So if you just understand this one slide, it will be more than enough for you in the examination. So we have 4 topics. One is trichomonas vaginalis, bacterial vaginosis, chlamydia and candida. Okay, so first of all, just write, this looks like 6, so this is a acidic. Okay, this both are alkaline. I told you that this is gray in color, this is strawberry cervix, and this is a greenish discharge. Candida, it's C for C, it's a curdy creamy, and this C is a purulent discharge. We took this candida as a cool means non-foul smelling. These are foul smelling, finish. We took this as one entity, this as one entity. In what sense? This needs partner treatment, this needs partner treatment. They both need no partner treatment. Isn't it? So are we getting it till here? Okay. Now remember, chlamydia is highly associated with corticosteroids use. That is, if someone uses corticosteroids, systemic corticosteroids or topical, systamine is a systemic, there are a high probability that this people will get chlamydial infection. And with that, you need to remember that corticosteroids causes immunocompromise. So immunocompromised patients are highly prone for having this one, okay, this disease, okay. Now, one more thing I would like to say, okay? So, bacterial vaginosis is the best, okay? Now, okay, again you say that C is cool, this is best, you are saying. So, what are you talking about? C. So, it's best in such a sense that, so if it troubles you, what is the thing? If someone troubles you, maybe an itching feeling, right? Itching. So you will see itching here, you will see itching here. Here plus minus. But here, bacterial vaginosis, there is no itching. There is no itching. It's very, beautiful. There is no itching in bacterial vaginosis. Now let's discuss the slides and let's complete this vaginal discharge. Okay. So normal vaginal discharge, it is watery, it's white in color, non-odorous with pH around 4. Microscopically, it contains squamous epithelial cells and there is few bacteria, lactobacilli, Dordelin bacilli, few gram-negative bacteria, anaerobes are present without any white or red blood cells. Okay, so it's non-foul smelling, non-odorous, non-foul smelling, that means non-odorous. pH is slightly acidic. pH is acidic. So acidic pH, it prevents the growth of other bacteria. But there is Dordelin bacilli, that is lactobacilli. Now major you need to remember 4 important. Bacteriovaginosis, Trichomonas, Candidiasis, Chlamydia. Gonococcal also you need to remember. Okay. Now bacteriovaginosis, very easy. B for bacteria, B for best. Why are we saying this best? Because there is no pruritus. Pruritus is absent. And the most common cause of vaginitis in the premenopausal women represents change in vaginal flora, decrease in the lactobacilli, increase in the Gardnerella vaginalis, Mycoplasma hominis, anaerobics, and it's a polymicrobial. Remember, one more thing I would like to add upon here, that bacterial vaginosis is not just caused by Gardnerella vaginalis. Okay, so there is the major culprit is Gardnerella vaginalis. It's Gardnerella vaginalis. Okay, but it's a polymicrobial. Now, how can you remember this? See, very easy. So B for bacterial vaginosis. I'm just saying with story so that you can remember. B is for best. Why is this best? Because there is no itching. There is no itching. Now just remember a garden. So there's a garden. Suppose this is a garden, green color garden, and here you have leaves. Here you have different type of plants, right? Different type of plants, different flowers. So what does this denote? There are different flowers. There's different flowers. There are different things, and this is a garden, isn't it? It's a garden. Now this different flower, it denotes that it's a polyflower component. So that is a polymicrobial. Exactly. So it's a polymicrobial. Okay, so there is anaerobes, there is Mycoplasma hominis, there is Peptostreptococci. Okay, so it's a polymicrobial. Okay. So they are asymptomatic. Why asymptomatic? They are the best. There is no itching. No itching. Unpleasant fishy smell. Remember, non-foul smelling was the cool one. The cool one was the candida. So this will be a fishy smell. Okay. And the discharge is grayish white. Don't remember creamy. Okay. No creamy. Grayish white. The grayish discharge will be there. Okay. No itching. No inflammation. Okay. But itching remember, inflammation, the vulva being red and swollen due to pruritus, will be seen more prominently with candida. Okay. So how can you remember that? Suppose if you don't take bath for 10 days. Okay. So don't take bath for 10 days. You're just using this cool menthol in your armpits. Why are you using this cool menthol in your armpits? Because for freshness, right? For freshness. So that there is no foul smelling, isn't it? But what will be there? There will be bacterial cultivation. Because these are not antimicrobial powders. What we use is give fragrance. There'll be cultivation of the bacteria. When there's cultivation of bacteria, you will itch it like anything. And wherever you itch, you put a powder for a cooling purpose. So remember, severe itching with candida. Along with itching, there is a vulva being red and swollen. So how beautifully you can see it's slightly gray, okay, slightly gray. It looks like curdy. It looks like curdy. Definitive diagnosis will be given by Amsler's criteria. Now, what is this Amsler criteria? So, okay, see. So, if there is thin grayish white discharge, okay, pH being more than 4.5. I already told you two entities, TV, BV, Candida, chlamydia. Both is alkaline, this both is acidic, isn't it? Now, so this is a alkaline, pH more than 7.5. Clue cells, clue cells, clue cells, clue cells, clue cells, and whiff test. Whiff test. So what is whiff test? Whiff test means fishy odor on addition of KOH or NaOH. Sometimes short notes, vaginal discharge can be asked in the exam. So if you write all this normal vaginal discharge is acidic in nature because of Dodolin bacilli, whenever there is bacterial contamination, whenever there is other bacteria, it will be changing the pH, maybe an alkaline, or it may retain the acidic property. Okay, this is the Amsler's criteria. See, beautifully it's written here also. Grayish white discharge, vaginal pH more than 4.5, positive whiff test, fishy odor on when mixed with 10% KOH, and clue cells on wet mount. Clue cells on wet mount. Okay, very important. See, these are the clue cells. Okay, these are the clue cells. So these, what are these actual clue cells? So these clue cells are, suppose this is your vaginal epithelium, and on top of it you will have bacteria. Bacteria. Don't forget, okay, B is for best. Why best? No itching. That's why best. C is for cool. Why cool? For freshness purpose, so non-foul smelling. Okay. Treatment, they may resolve spontaneously. Okay. Back to vaginosis, metronidazole, or we can give clindamycin, but metronidazole preferred. Per oral 400 mg TDS. Are we treating the partner in bacterial vaginosis? No. Why? TV, BV, C, C. 1, this 2 is taken as one entity. Right? So here we have to treat the partner. Here we have to treat the partner. But here we don't need to treat the partner. Okay? So you can remember that the best and the cool ones are those who don't torture the husband. How beautifully we have understood. The best and the cool wives are those who don't torture their husband by giving these antibiotics or giving antifungals, as in the case of candida. Okay? Or we can just give clindamycin, as effective as metronidazole, right? Now complication, or can be the complication of bacterial vaginosis. So preterm labor can be there in pregnant women, chorioamnitis can be there, premature rupture of membrane can be there, right? Endometritis, postpartum fever, post-hysterectomy, vaginal cough, cellulitis, post-abortion infection, right? Now trichomonas. So trichomonas, remember TB, trichomonas vaginalis, this is a parasite. How are we going to treat this? Metronidazole, very good. Trichomonas, remember green, red. Red for strawberry cervix, green for green frothy discharge. We are going to torture the husband because trichomonas is not best or cool, right? So we are going to torture. Wow, T for trichomonas vaginalis, T for torture your husband by giving antibiotics. Okay. So 20% are asymptomatic, others develop symptom 4 to 28 days after sexual contact with infected partner or infected material like towel or toilet. Organisms is Trichomonas vaginalis, unicellular flagellated protozoa. Profuse, thin, frothy, creamy, yellow, green discharge. Mean is green discharge, okay? So remember this dyspareunia, where does dyspareunia occurs? So remember, wherever there is itching, there will be dyspareunia, okay? So since we talked about bacterial vaginosis right now, there won't be dyspareunia as such, but here in trichomonas, there will be dyspareunia. Pruritus vulva, there will be pain, there will be dysuria, okay? Bacterial vaginosis was best. Why? Because there was no itching. There was no itching, but it is a foul smelling. cool is only non-foul smelling. Okay, vulva is erythematous, edematous, excoriated mark. See, so they often, they itch their vulva so much that there will be excoriation. Like in this case, in the case of scabies, also you see excoriation. The vagina looks inflamed. Strawberry spots in the vagina cervix, right? Cervix. So if you just evaluate the cervix, you'll see like this kind of strawberry marks, right? Identification, microscopic examination of the saline preparation of the discharge, flagellated anaerobic protozoa, okay? And vaginal pH is acidic. Sorry, vaginal pH is alkaline because trichomonas and bacterial vaginosis was alkaline. Candida and chlamydia is acidic. Very good. Can you see the strawberry cervix? Wow, what a beautiful diagram. So this can be asked in the spotters, okay? Beautifully diagram. A 40-year-old woman comes to the Department of Gynecology with severe itching in the vulva, severe pruritus, and she has greenish discharge. On examination of the cervix looks like this. What is your treatment? Give one drug for treatment. Guy, give your diagnosis. Trichomoniasis is the diagnosis and metronidazole is the treatment. Do you need to treat the husband? Yes. Treat the husband, torture the husband with antibiotic. Okay. Treatment for both partners. Very, very, very important. Okay. Torture the husband by giving antibiotics. Metronidazole, tinidazole, secnidazole. Avoid physical contact or use barrier method of contraception during the therapy. Excellent, important thing. Why? See, if they don't use barriers, the disease will never stop, okay? It will recur time and again. So you have to use barrier unless you are completely cured, okay? Now, next is candidiasis or moniliasis. So what is for candidiasis? Creamy discharge, cool. Why cool? Because it's non-foul smelling. Is it pruritus? Yes, of course it is pruritus. What happens because of pruritus? Dyspareunia, dysuria, pain, itching. Okay, simple. So it's pruritus, pain, swelling, curdy white discharge will be said, most commonly caused by Candida albicans, and this is a fungi. Very good. So you can go for a QH mount test or you can just cultivate indoors, Sobaros, dextrose agar. Vaginal pH is, it's normal, or basically it's acidic. Is normal, vaginal pH is acidic. So it's written that vaginal pH is normal. But do not write vaginal pH is normal in the case of Trichomonas vaginalis and bacterial vaginosis where these pH gets elevated. So risk factors, as I already told you in the first lesson, that the risk factors is those who are taking corticosteroids, steroid therapy. So steroid therapy means immunosuppression, diabetes, broad spectrum antibiotics, pregnancy, all is a stress state, right? Now treatment, you are going to give azoles, AZOLS, azoles, you have to give azoles. You have to cotrimazole, 1% vaginal cream for 7 to 10 days. You can use fluconazole. Azoles treatment, cotrimazole, fluconazole. Okay, very good. Next is gonococcal. So before discussing gonococcal, I want to discuss chlamydia trachomatis. Chlamydia trachomatis, it is purulent. The discharge is purulent. pH is alkaline. Very good. Now, chlamydia, what is the most important thing that you should understand? Treated with azithromycin. Very good. Chlamydia, is it pruritus? Yes, it might be pruritus, it might not be pruritus. Is it foul smelling? Yes, it is foul smelling. The only non-foul smelling is the cool ones, that is the candida. The only non-pruritic is the best one, that is the bacterial vaginosis. Okay. Criteria for bacterial vaginosis, Amsler's criteria. So if you itch, there will be dyspareunia, there will be dysuria, there will be pain. Okay. You are going to treat the partner with chlamydia? Yes, of course. So obligate intracellular parasite, mainly asymptomatic, screening with those with high risk. Sexual partner must be counseled, tested and treated. Okay. So you can give azithromycin, doxycycline, erythromycin, ofloxacin, levofloxacin. Okay. Now next is gonococcal. So gonococcal or gonorrhea. Okay, gonococcal or gonorrhea, you say it. So they present with a chancre, right? Chancroid. We have to say chancroid. Now these are usually painful chancroid. Okay. So there will be vaginitis, cervicitis, and there might be lymph node involvement, and there can be enlarged tender lymph node, or the condition will be asymptomatic. Asymptomatic symptoms for women with high risk vaginitis cervicitis, profuse or non-irritant white to yellow discharge, can cause upper genital tract infection. Recommended treatment of uncomplicated gonadal infection of cervix, urethra, or rectum is ceftriaxone. This is a third generation cephalosporin or doxycycline. Okay. So we are clear till here. So this is a case of grayish white discharge. So this is a grayish white is bacterial vaginosis. So this is a candida, curdy white discharge, and this is a cervicitis. This is a cervicitis, inflammation of the cervix. Of course, there is inflammation of the cervix, and this is trichomonas vaginalis. Very good. So, for whom we are going to go for an inpatient, outpatient management, and for whom we are going to give for other treatment. Now, moreover on this, we'll be discussing on PID, pelvic inflammatory disease, in the next.